This is the Emergency Medical Minute, sponsored by Health One.
So I'm going to do a quick medical minute on something that was on the board. So you guys have put back kind of a bunch of things that you want to learn about. And someone said anticoagulation versus antiplatelet. So when do we decide to give someone an antiplatelet versus anticoagulation? Does anyone know kind of broadly? A valve. Perfect, Sarah. That's it. The medical minute's over. No. So here's the easy way to think about it. If it's arterial, it gets an antiplatelet. And if it's venous, or if it's a slow flow state, it gets an anticoagulant, okay? And the reason why is really, right, the platelets are like your bricks, and then the coagulation factors are like your mortar that hold them all together. And for really high flow areas, it's actually more of a platelet or a white clot that you get. And then for something like a low flow venous state, like a DVT, it's more that you get a clot that's more coagulation factors than it is platelets, okay? So if it's a DVT, if it's a PE, which is nothing but a DVT that's basically traveled from the leg to the chest, you basically get anticoagulation. And then if it's something like antiplatelets for like ACS and heart disease or an ischemic limb, those are all antiplatelet agents first: heparin, Plavix, aspirin, etc. So the other thing about antiplatelets that we see in anticoagulation is when people are bleeding. And which one's usually a little worse? Anticoagulants or antiplatelets? It's actually antiplatelets are a little more of a difficult issue to deal with. And the reason why is because your body, where are platelets made? They're made in the bone marrow, right? And the bone marrow is kind of pumps out stuff like at a pretty like slow basis, right? So if you're on antiplatelets, in order to get enough platelets to really get good hemostasis, it actually takes a long time for your body to make enough new platelets that are actually able to create good clot. Whereas anticoagulants are made where? In your liver, right? And your liver is super good at producing stuff and producing stuff very quickly. So usually if you're on something like Plavix, you need to wait like a week or so before you can get surgery. Whereas if you're on something like Xarelto, et cetera, you just need to wait sometimes a day or two, and then you can get a surgery for it. And then we also have PCC and other factors to reverse anticoagulants quickly. Whereas with antiplatelets, you can give more platelets, but that really hasn't been shown to have good effect because the platelets that we usually give aren't actually that active. Okay, so just a few little learning points on anticoagulation versus antiplatelets. Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.